This is the second presentation in the introductory series on the topic of musculoskeletal radiography. The intent of this presentation is to provide a description and give examples of pertinent soft tissue alterations you may encounter during musculoskeletal radiography in your veterinary patients. By the end of the presentation, you should be able to identify and describe the alterations that we might see in the soft tissues, and then provide some differentials for the abnormalities identified. The first thing that we'll look at is the most common opacity change encountered, and that is increased soft tissue or fluid opacity. This leads to lack of visualization of the normal fascial planes between soft tissues, which are made up of fat, so they should be more lucent than the soft tissues around them. It may also cause distortion of the normal fat striping. The cause is nonspecific, and edema, hemorrhage, inflammation, or neoplastic infiltration in the region can lead to increased soft tissue or fluid opacity and obscure the fascial planes. So this is a dog that has fractures of the radius and the ulna, and if you look here, there's normal fatty stripe, fascial plane, and then in this area there's too much soft tissue or fluid opacity that's distorting those. And in this case, it's probably a combination of edema and hemorrhage. Another encountered opacity change is gas within the soft tissues. And when we identify gas, or again gas opacity within the soft tissues, we should consider some potential causes. And causes include iatrogenic reasons. Iatrogenic reasons would be things such as post-arthrocentesis or post-operative, or potentially in our horses, to keep in mind, we oftentimes take radiographs after nerve and joint blocks, and so we may identify gas. Certainly a skin wound or laceration, so communication with the external environment, can lead to gas within the soft tissue. And then the final and least common would be infection with a gas-producing organism, which is what we see to the right of the slide in this calf. Soft tissues of the anabrachium and the carpus, there is a large amount of gas opacity within soft tissues that also have increased soft tissue and fluid opacity, and this is Clostridial disease. Another opacity change we may identify within the soft tissues is mineralization. And in the examples we're going to encounter in our series of musculoskeletal radiography is typically mineralization from dystrophic mineralization. And dystrophic mineralization is mineralization of dead, devitalized, or degenerative soft tissues in patients who have normal calcium and phosphorus levels. There are a lot of potential causes that might be chronic changes from blunt trauma or parasite migration, granulomatous disease, previous thermal injury or inflammation, even sometimes site of injections, especially steroid injections. And then we can have chondrocalcinosis, which can occur secondary to arthritis. And then certainly patients who have calcinosis circumscripta may have soft tissue dystrophic mineralization. The example to the right of our slide here is a dog tarsus where there is soft tissue change that's both increased soft tissue opacity but also has this kind of irregular mineralization. This is likely dystrophic mineralization from prior trauma to the collateral ligament of this tarsus. Soft tissue neoplasms can sometimes actually form new bone, and one example we might see in musculoskeletal is soft tissue osteosarcomas, which will actually form new bone. And then mammary cancer can also form new bone. And then a final type of mineralization of soft tissues you may learn about in other courses is metastatic mineralization, which occurs in normal soft tissues in patients that have elevated calcium and phosphorus product. We may also be able to identify foreign material within the soft tissues, and foreign material may appear as in this dog, kind of metatarsus digits, where it is actually a radiolucent line of a stick that is still air-filled within the soft tissues of this patient. Or as in the patient on the right, which are also digits from a dog, where there is a mineral opaque foreign object embedded in the pad, and this happens to be gravel. More often than not, foreign material will not be identified on our radiographs because it is often soft tissue opacity. Plant and wood material often becomes soaked with fluid surrounding it, and so then it's going to be the same as soft tissue and not identified on our radiographs. We oftentimes encounter enlargement of soft tissues, and enlargement of soft tissues can be due to joint swelling, which I also will refer to as intracapsular swelling, so swelling within the joint. And this type of swelling is going to be centered on a joint and then confined to the expected joint capsule. One thing to always keep in mind is that the joint capsule oftentimes extends beyond where we see our joint on the radiographs, and so having a knowledge of what that joint capsule will look like in that area is going to be important. Joint swelling is very nonspecific, and causes of the swelling include effusion, so actual fluid within the joint, and that could be traumatic, inflammatory, septic, or hemorrhagic. But joint swelling can also be caused by increased synovial mass, and that synovial mass may be from synovial proliferation, which can be, a benign thing, but can also be from a neoplastic infiltrate of the synovium. And we're not going to be able to specifically determine the cause on the radiographs. This slide shows examples of soft tissue enlargements. On the left is a tarsus of a horse, and if you notice, here is quite a bit of enlarged soft tissue, so soft tissue fluid opacity that is really confined to that tarsocrural joint. It's centered on the tarsocrural joint. So this is joint swelling or intracapsular swelling. And in this patient, it's a young patient with osteochondritis dissecans. This is all effusion. We would only be able to determine that if we maybe ultrasounded and could tell the joint capsule from the actual fluid. This is a lateral view of a stifle of a dog that has chronic cranial cruciate ligament instability, and this is an example of soft tissue swelling that is centered on that stifle joint. Remember, in the dog and horse stifle, there's an infrapatellar fat pad that should be a nice normal triangle. So by seeing that that is displaced and distorted, helps us recognize soft tissue swelling. It's also enlarged and distorting the caudal fascial plane. So in this case, this is a combination of effusion but also synovial proliferation. So two types of causes to this joint swelling. And then in this last example, this is actually a patient that has soft tissue swelling that is centered on the stifle joint. So again, joint swelling or intracapsular swelling, which is actually entirely due to a soft tissue neoplasm, which is infiltrating that joint capsule. So this is tumor mass. So again, we cannot identify the actual underlying cause. Soft tissue enlargement can also be due to extracapsular swelling, which is swelling that is away from our joint or extending beyond the expected joint capsule margins. Now, keep in mind that if it extends proximal and distal to a joint, that we may have both extracapsular and intracapsular or joint swelling, so we can obscure that. This is also nonspecific, and causes could include edema, hemorrhage, inflammation, and neoplasia, or a combination of any of those. So this is an example of a distal tibia and fibula in a dog. So we're near the tarsocrural joint, but notice the soft tissue swelling is proximal to the expected level of this joint capsule. It's also quite irregular, different from the other intracapsular soft tissue swelling we saw. And then there's some osseous change as well. But this happens to be granulation tissue and probably cellulitis because this patient has some osteomyelitis. Less commonly on radiographs, we may recognize a decrease in the size of soft tissues. Certainly when we have two limbs for comparison, like in a pelvic radiograph, it might be easier to recognize this. And in our examples in our series, we will probably be mainly identifying atrophy, which is disuse atrophy, which is fairly common. In this patient on this extended limb ventrodorsal view of the pelvis, these are the normal soft tissues on the left where I can see muscle fascial planes, where on the right here I can see that these soft tissues are much smaller, and this is a patient that has lameness on the right, and so this is disuse atrophy. Neurogenic atrophy can also occur, and that might occur secondary to nerve trauma or infiltration. I don't recognize those quite as often. In summary, keeping in mind these soft tissue alterations, evaluation for these abnormalities might help us more quickly find the cause of the clinical signs and then point us towards the osseous abnormalities that we're going to learn about in the next presentation. As I said in my systematic review, I like to start with the soft tissues, and this just happens to be the foot of a dog where there's quite a bit of soft tissue swelling that is surrounding this distal limb, this specific digit, which happens to be the 4th digit. And when I look more closely, then I can see that the distal phalanx actually has quite a bit of lysis compared to the other distal phalanges, and this happens to be a fungal infection of this digit.